Welcome to NICU in a Nutshell, where we talk about all things neonatal in a simple and easy way to understand. While this isn't meant to be medical advice, it is a place for education, questions, and community. My name is Anna. Let's get started. Hi everyone. Today we're going to be talking about APGARs. What are they and what do they mean? An APGAR is a score given to your baby minutes after delivery to give us an idea of how much help or resuscitation your baby needed after birth. Every baby will typically have a 1 and a 5-minute APGAR score, and depending on how much assistance your baby needs after delivery, your baby might have a 10, 15, or 20-minute APGAR score. While these scores are not intended to be predictors of long-term development for your baby, we do typically think of a score of 0 to 3 at the 10-minute of life APGAR as an indicator for challenges your baby might have in the NICU. These scores for every time increment we give, there are 5 different categories, and each category can have a score of 0 to 2. And while 10 is technically possible, it's highly unlikely that your baby should have an APGAR of 10 because all babies have some blue hues left in their hands and feet just based on heart anatomy, which we can get into in a different video. Let's review what APGAR actually stands for. A is for appearance or the color of your baby. P is for pulse or heart rate, so how fast or slow your baby's heart is beating. G is for grimace or irritability, which is how is your baby interacting with the providers giving the help after birth? Are they responsive to touch or are they just laying in the bed? A is for activity and muscle tone, so is your baby moving their arms and legs everywhere, or are they what we call floppy, meaning if you lift their arms or legs, they just fall right back to the bed. And last we have R for respirations. So this is how fast or slow the baby is breathing, but also what kind of effort, if any, they have. Let's take a deeper dive into the aspects of each APGAR so you can get an understanding of how they're scored. So as you can see, APGAR scores for each category, your baby can either get a 2, 1, or 0. So starting with appearance, if your baby is pink all over, including hands and feet, he or she will get a score of a 2. Babies with blue extremities, such as the hands and feet, will get a score of 1. And babies that are pale or blue all over will get a score of 0. And like I said, all babies will have some sort of blue hue in their hands and feet due to the way their heart is structured, going from in the belly to the outside world. Next, we're going to look at pulse. For a score of 2, we want your baby's heart rate to be above 100 beats per minute. So for us adults, that seems really high, like we're exercising. However, for your baby, we want their heart rate to be really fast. So a typical heart rate is between 120 and 160 beats per minute for a newborn or a premature baby. So we really want that heart rate to be over 100 beats per minute at delivery. For a score of 1, your baby's heart rate is less than 100 beats per minute, but does have a heart rate, compared to a score of 0, which your baby does not have a heartbeat. Grimace or irritability, for a score of 2, your baby cries and pulls away. Keep in mind that your babies want to be in the comfort and safety of mom's belly. So being out into the big, scary, and very cold world, they do get irritated and they cry. So we want a baby to not like it when we're touching them in those initial few minutes because it shows us that they're reactive to our touch. A score of 1, baby might grimace and have a weak cry. With a score of 0, there's no response to stimulation at all. Moving on to activity or tone. A score of 2, your baby has active movements, meaning arms and legs are flailing, kind of what you would expect from a newborn if you were not in a NICU setting. Score of 1, arms and legs are flexed. So this means arms and legs come towards the middle of the body, so towards the abdomen and the chest, kind of like the fetal position, but not that active movement that we would see in a score of 2. Last, a score of 0 is no movement. So like I mentioned before, if we try to lift your baby's arms or legs, they just fall back to the bed without any active resistance by the baby. Last, we have respirations, and this is your baby's breathing effort. A score of 2 is a strong cry. Your baby's breathing on their own without any needed assistance. A score of 1 is slow and irregular. Similarly to a heart rate that we expect to be higher for newborns, we expect a respiratory rate, which is how fast or slow your baby is breathing, to be higher than an expected adult or even older pediatric patient. For adults, our expected respiratory rate is anywhere from 12 to 20, while for our newborns, we want that rate to be somewhere between 30 and 60 beats per minute. So if we have a slower than 30 breaths per minute and irregular in any way, your baby will get a score of 1. And then similarly to our heart rate and grimace, no breathing or respiratory effort will get a score of 0. As a reminder, all of these numbers are added up to a possibility of 10 for 1 in 5 minutes. Depending on how much help your baby needs after delivery, you might possibly have an APGAR score of 10, 15, or 20 minutes. I hope this helps give you a better understanding of APGAR scores, why we use them, and what they mean. Thanks for joining us today. Please make sure to hit that subscribe button to get notified of our future videos and to join our community. Have a great day.